Well, let's get started. Welcome, everybody, to the Iowa Cancer Plan Implementation Grants FY26 Invitation for Proposals Applicant webinar. My name is Liz Orton. I use she, her pronouns, and I'm an outreach coordinator at the Iowa Cancer Consortium. And let me get over here. Right. Let's see. Okay, so I will just take a moment to talk about the mission of the Iowa Cancer Consortium, since that is really what these grants are all about, with the cancer plan and our mission statement. So our mission is to advance cancer prevention and control in Iowa through advocacy, equity, and collaboration. You can learn more about us at canceriowa.org. For some staff introductions, I've got everybody's email addresses on the screen. The main contacts for the grants are going to be myself, and then Rachel Schramm and Kelly Wells-Sittig. And we'll have our email addresses up on here, and they're on our website as well. So please feel free to reach out with any questions as you kind of go through the process of the grant. So first, I want to talk about the Iowa Cancer Plan, since these are the Iowa Cancer Plan implementation grants. You can find the Iowa Cancer Plan at canceriowa.org. There's a link right there on the homepage to it. And the Iowa Cancer Plan is a blueprint for action. It brings Iowans together to reduce the burden of cancer in Iowa. It's created by experts, most of them who live in Iowa, and then just everyday Iowans across the state. And it includes 5 chapters focused on cancer as it relates to health equity, prevention and risk reduction, early detection and screening, diagnosis and cancer-directed therapy, and survivorship and end-of-life care. So from that, you can see that many, many projects and organizations are going to find things that they can implement from the Iowa Cancer Plan with these grants. One more thing about the Iowa Cancer Plan. So as you're exploring it, you'll see the 5 different chapters, but then you'll also see different strategies and priorities. And these are evidence-based interventions that can be taken and implemented. And so kind of the purpose of these grants is to select, one or more of these evidence-based interventions and implement them, maybe, put your own flair on it, or if there's other evidence-based interventions that you would like to try, but they kind of coincide with a strategy that's already in there, like that's kind of the goal of this. So each year, our board of directors identifies priorities where they will put a priority on funding projects that address these things. So for this year, it's projects that address cancer disparities across the cancer continuum, address cancer prevention and/or early detection, expand successful local projects statewide in Iowa, or projects that formalize lasting and broad change in cancer control through policy and systems change within organizations, systems, and communities. But with that, funds may not be used for lobbying. So just a reminder of that. Your project can address one of these or several, and you'll see later on in the presentation how these are scored on the scoring rubric too. So here is a lot of information, and just to let you know, you can find all of this on the grant webpage. If one of my colleagues could put the link in the chat. But then also make sure that you take a look at the instructions document as well as the whole application document, and this will have all of this information. So for eligibility, once awarded, the grantee must become consortium members if they're not already, and we do have free scholarship options available. All grant-funded activities must be tobacco-free and held at tobacco-free locations. The award amounts are up to $25,000 per year, and that's for one project. They can request up to $25,000 per year. You can request up to 3 years of funding, but it will be a competitive reapplication every year. And I'll explain that more when I show you the application later on, so you can kind of get a better idea of what that looks like. But basically, if you apply for year one of a multi-year project this year, it's not guaranteed that you'll get funding for year two, but you can apply for year two, and then you'll be able to show your successes and challenges from year one to make a strong application for year two. For use of grant funds, I will quickly go through these, but there is much more detail in the actual application in the budget section. So things that are allowed would be staff salaries, consultant fees, data collection and analysis, meetings, supplies, project-related travel, and other direct project expenses. You can also request indirect or administrative costs up to 8% of funds requested. This needs to be within the $25,000. So if you're requesting up to 8%, you still cannot request more than $25,000, if that makes sense. Not allowed would be lobbying, replacing dollars currently earmarked for cancer programs, clinical care, including the provision of medication, vaccinations, or cancer treatment. Things that the board will consider, so you just need to justify it really well in your application, would be actual service delivery, including radon mitigation and cancer screening, equipment worth more than $5,000, that those items will be reviewed on an individual basis. So make sure that there's a lot of justification for that. A note about incentives. Incentives are allowable if it's part of an evidence-based intervention. So make sure that you talk in the scientific evidence part of the application about the incentives if you're going to request them on your budget. The project period is July 1st of this year through May 31st of 2026. So just want to highlight that that is 11 months and not a full 12 months. And that'll be really important on your budget, that you're budgeting for 11 months, as well as your objectives, that they can be done in an 11-month time frame. Your project reach, it must serve Iowans. Sometimes in the past, we've had maybe a virtual program. And so people from other states are able to attend because it's virtual, but the focus needs to be on Iowans. So just make sure that, if you are based in Nebraska or something like that, that you talk about how you're serving Iowans. So the evaluation for applications, they are scored by independent reviewers outside of the state of Iowa who are experts in cancer control. And then they're also scored by the Iowa Cancer Consortium Board of Directors. The Board of Directors discusses and votes upon who is going to be awarded, and it's the sole discretion of the Board of Directors. And so, like it says here, scores from independent reviewers are used to assist the board in making their decision, but the board is ultimately responsible for choosing which applications are awarded. And of course, our board of directors represent a lot of different organizations, some of which may be applying for funding. And so we put them in a waiting room, or, they're not in the room when their grant is discussed. They do not make decisions on funding for anything that they might be related to. And that includes you might have a letter of support from one of our board members because of, the organization that they work for is working with you on this. So just know that they are very careful to avoid conflicts of interest, and you can still partner with them and their organizations on these projects. For monitoring, so once awarded, consortium staff work closely with grantees to ensure they have the tools to be successful and maintain stewardship of state and federal grant funds. Grantees are required to submit 2 progress reports, and those reports include a short narrative and a financial update, and then as well as you do a budget update. More details on reporting requirements are given once the award is announced and contract is signed and everything like that. So you'll know a lot more what to expect. So new this year, we really wanted to help people kind of just be prepared for success. So a note regarding audience as you write your application, because we have external reviewers and just because not everyone in Iowa is familiar with everything going on in Iowa. We want you to write with an external audience in mind. Don't assume that the reader is familiar with your organization, your current projects, or your previous work. So include concise background information throughout the application that will help an external audience fully understand your project. So basically, assume that you've never met this person and you're trying to concisely explain to them what you do, what your project's going to be, and why it's important. A note regarding collaboration. Collaboration is central to our mission, and these grants are a reflection of that core value. Each project must include at least one collaborator, accompanied by a letter of support from every collaborator listed. And while it's not an absolute rule, collaborators are generally expected to come from outside your organization or community to highlight the expanse of your planned partnerships. If your project serves a specific community, you must be able to show interest in collaboration from that community through a letter of support. So let me know if you have any questions on that. We'll also go over this as we go through the application as well. And just a reminder, you can put questions in the chat or feel free to come off mute at any time, not just about this. And then a note regarding funding sources. Iowa Cancer Plan implementation grants will be funded by state comprehensive cancer control dollars through a contract with the Iowa Department of Health and Human Services, as well as Iowa Cancer Consortium general funds. So that's kind of where we're pulling these dollars from. But we are still waiting to understand how our own fiscal year 26 funding will work. And so funding for FY26 Iowa Cancer Plan implementation grants is dependent on funding from the CDC, Iowa HHS, and the state of Iowa. So just want to put that asterisk in there. So I'm not going to go through all of this unless there is questions, but here's my little laser pointer. So basically we're going to walk through the application, and if you have questions, let me know. But just hopefully this will help people who often we get a lot of the same questions every year. So basically you're going to put in some basic information here in the applicant information section. Your project title, your total amount of funds requested, and this is that up to $25,000. Even if you plan to apply for a multi-year project, you're just applying for 1 year at a time. And so it would be the top amount would be $25,000. Provide a brief description and any relevant background information. This is like the protein of your application, like the meat of your application. You want to describe your project, and like I said, pretend like you're talking to someone who's never heard of your organization before. So this is a really important section. And then we have suggested word limits, but it's not, if you need to use more than 1,000 words or less, that's fine. Just whatever you feel is right for your answer. Talk about how many individuals you expect to reach, which counties you expect to reach. And then talk about which or, however many of these priorities your project addresses. And so in every section, there's a place to click or tap to enter your text. So just make sure you look for those. Sometimes they can be a little bit hard to see. On the next page, you're going to indicate what type of funding you're applying to. So this is whether it's single year or if you're applying for year 1 of a multi-year project. There are just a couple of projects that year 2 or year 3 would apply to. So if you got year 1 of a multi-year funding last year, then you would apply for year 2 and so on. And then similarly, if you have already done a year or more, you would answer this question. But if this is your first year, then you don't answer this question. And then here, list the goals and strategies from the Iowa Cancer Plan that your project will support or help implement. This doesn't need to be long. You can literally list, what those, which ones you're addressing. Project objectives. This part is very important because your objectives are going to serve, for the most part, as your deliverables if you are awarded funds. So these will be on your contract, and this is what you will need to accomplish. These can be changed or edited or whatever if the board requests it, and then it would be a conversation with you and working together to change those objectives. They won't just change on you, mid-project or anything like that. We would talk about it. So these should be written as a SMARTY goal, and SMARTY stands for specific, measurable, attainable, relevant, time-based, inclusive, and equitable. And on the application and on the grants website, we have a link to a really good resource with examples of this. So if you need help writing that, check out that resource. And then, of course, that's something you can ask us about as well. So you need at least 3 objectives. You can add more if that is reasonable and something that you think is important for your project. And so you write your full objective here, and then we've kind of asked some other frequently requested information from the board. And just a reminder to put in the deadline of when you're going to accomplish this objective. And then if you have any baseline data, so say that your objective was to increase HPV vaccination by 5%. We want to know, what are your HPV vaccination numbers right now? So how many are you doing in a given period of time, or whatever makes sense for that statistic? And then what is your target by the deadline? So it's probably up here in your objective, but then just kind of take it out and highlight it down here as well of what is your target by that deadline. And that just really helps us keep things, we're able to see quickly, what are we measuring? How are we going to measure it? Stuff like that. So those you would fill in the 3 objectives and then add more if you have more. And then we talked a little bit about project collaborators already, and this is where you would put in their information. So you need at least 1, but you can have more than that. But any collaborator that you list needs to have a letter of support attached with your application. And there are sample letters of support on the grant website. And so this part is pretty simple. You put in their information and then just a really brief description of what are they going to do in the project, what are their roles and responsibilities. All right. The next section is about evidence and evaluation, and we have some resources right here on the application that we encourage you to look at definitely before writing this section. So in the what scientific evidence is there that your project will be effective, this is where you would reference evidence-based interventions, like either things that have been done before or things similar to what you want to do, or maybe it's an evidence-based intervention for, one type of, I'm just spitballing here, but one type of cancer that you want to implement for a different or something like that. But there needs to be strong evidence of how and why it will work. And then how will you evaluate your project? So that's are you going to do surveys for participants? Are you going to have outside evaluators evaluate the project? So basically tell us, how will you know if you've been successful? And then this one's really important. How will you modify your project to meet the unique needs of certain populations? So just making sure that whatever your project is, that it truly can reach all Iowans or all, whoever, maybe your project scope isn't all of Iowa, maybe it's a county or something like that, but just make sure that you think about, what might somebody need if they don't have access to a car? What might somebody need if they don't have an internet connection? So how can you address those different barriers for people being able to participate in your project? Different languages, things like that is important to think about too. Okay, I promise I am not going to read all of this because that is overwhelming, but this is in our application and you should read all of it before filling out the budget. So we talked about what was eligible for funding, and this goes into more detail. And so just really note, it kind of gives you all the calculations. If you're going to ask for travel reimbursements, here is what is allowable, and things like that. So, so again, let us know if you have any questions either now or later as you're filling out this section. Here you will briefly explain your budget in words. This is where you justify anything that you're, so say that you were asking for a piece of equipment that was $5,000 or more. Here is where you would tell us why that is so important for your project, and you would justify, it's not always funded unless the board decides that there's a reason to fund it for this project. So that's where you would put your justifications, as well as just kind of like a brief narrative of how the funds will be used. Then you fill out this table, and you can add more rows as necessary. And then just another reminder, this is for 11 months, not 12 months. So if you're calculating somebody's salary, make sure it's for 11 months. All right. So that was the end of the application. And now I'm moving into the scoring rubric. And again, this is available on the grants page. Sorry that it's like kind of chopped up. I just wanted to get more on each slide. And so another key to success is read the rubric and make sure that you're addressing everything to get the most points possible. So they're going to be looking at, does your application address one or more of the following priorities, and how well did you address it? So you can see the ways that they can score it. Project objectives, they're going to just really make sure that you have 3, that they're written as SMARTY goals, that you've got all your data identified, and then some more subjective things like, are the objectives likely to help the project succeed? And so that's where, you're going to be explaining things in your application for the external reviewers and the board to decide. Your project summary. Again, you can see your project summary is worth 20 points. So that is where you're explaining your project and what your organization does and why this is needed. So it's a really important part of your application. And then project collaborators, budget, and evidence and evaluation. So just definitely read through all of that to make sure that you're getting as many points as you can. All right, so here's your application checklist. The letter of intent needs to be emailed to myself by 11:59 p.m. Central Time on April 30th, 2025. I will put my email in the chat. There is an example, can't type and talk at the same time. There's an example letter of intent on the grants website. This can be very simple. It can be such and such organization intends to apply for an FY26 Iowa Cancer Plan implementation grant. And then if you know, like hopefully you kind of know the general area that you're going to be, or like topic of your project. So if it's, our project will address HPV vaccination rates in Henry County or something like that. So it can be as brief as our organization intends to apply, or if you know more information, that's also just helpful for us to know for planning purposes. You must submit a letter of intent if you intend to apply. Everybody who submits a letter of intent is eligible to apply. So there won't be invitations to apply after that. If you submit a letter of intent, you can submit an application. But if you do not submit a letter of intent, you cannot submit an application. So that April 30th deadline is extremely important. We will not be extending it this year. In past years, inevitably, you always get a request to extend it. We are just not going to do that this year. We really need to stay on a set timeline and everything like that. So April 30th, email your letter of intent. over to the right window. Make sure on your application that your project addresses goals, priorities, strategies, and/or action steps within the Iowa Cancer Plan. Make sure that your budget items are explained and totals are accurate. Remember that this is an 11-month project period and not 12 months. Make sure that your letters of support are included from all collaborators listed on the application. Make sure that any resumes or curriculum vitas are included for each staff member if funding is requested for their time. And staff member, or if this was like a consultant or anybody that's going to be paid for their time out of your requested funds, we need to have a resume or a CV. If the application or if the funding is requested to hire someone new, then having a position description and then just an explanation that like this, with this funding, we will hire someone to fill this role, and then talk about what the role is. If possible, if you could compile all those application documents, so the application, letters of support, resumes and CVs, any other documents into a single PDF, that is wonderful. But if not, no worries. You can send me several attachments and then I'll put them together in one PDF. So you're going to send that complete application. You're going to email it to myself by 11:59 p.m. Central on May 14th, 2025. And then, like I've said, samples are available at canceroiowa.org/grants/IFP. And also on that website, you'll find all of the resources that we've mentioned, as well as you can read about what projects were funded this fiscal year in FY25 to kind of give you an idea of successful projects. There are links to learn about evidence-based interventions in public health. Definitely read relevant sections of the Iowa Cancer Plan for what your project is about. Access Cancer in Iowa reports from the Iowa Cancer Registry with Iowa-specific data and topics. This can really help if in the project summary where you're explaining why is this even needed, to use some of that data that you can find from the Iowa Cancer Registry or the CDC, different places like that that publish data. We have practice and sample Smarty objectives linked on the website. All right, so those were your resources. So here's the timeline laid out. So again, letters of intent are due April 30th by 11:59 p.m. Central. Applications are due May 14th by 11:59 p.m. Central. And then tentatively, we expect to announce award funding announce awards on June 25th, but that is tentative to the board making those decisions. You would be notified via email. And then once we have, we notify the groups that are, or the organizations that are funded, and then make sure that we hear communication back from them. And then we typically would notify folks who weren't funded to kind of close the loop on that. We also offer feedback. I think this goes into our next slide. We offer feedback if your application was not funded, but we hope that you'll request feedback and support before you even submit the application. So our staff, we do not make funding decisions, and so we are available here to support you in your application. And so you're strongly encouraged to use us as a resource to either talk about your application or your project, or if you get your application done early enough, then we're able to review it as a staff and provide feedback. But this is not a requirement, and it'll have no effect on your proposal scoring other than we're able to provide feedback like, hey, on the rubric, it has that you need this, this, and this, and I noticed you're missing this in your application. So it's like an extra set of eyes, but it's not, on nowhere are we marking like they asked us for feedback, give them more points or anything like that. So it doesn't affect your score. So if you'd like us to help with that or schedule a time to talk about your ideas, send me an email. With that, that is the end of my presentation. So Any questions for myself or Rachel or Kelly? Okay, so in the chat, just to clarify, a multi-year project plan allows you to ask for $25,000 each year. Yes, so you can ask for $25,000 a year for 3 years, which in total would be $75,000. Yep, that is correct. And then, yes, thank you. Another thing about the multi-year project, what was I going to say? I lost my train of thought, but if I remember, I will say it. I remember what it was. Okay, so one organization, so even if they complete a 3-year project, if they had a totally different project, they are eligible to then apply and receive funding for a different project. It just can't be the same exact project for more than 3 years, just so that we're able to provide funding to more projects.